Welcome back, 6:28 on your Tuesday morning. As the weather warms up, kids are ready to get outside and play. This weekend, several youth baseball teams took part in a tournament near St. Louis. There were safety guidelines in place to protect players and coaches from the coronavirus, but is that truly enough right now?
So this morning we are joined live with Dr. Dana Hawkinson with the University of Kansas Health System, as we always are on Tuesdays and Thursdays. So doctor, a lot of parents wanted us to ask, is it okay to let your kids play, especially, with other kids, obviously?
Yeah. Yeah, I mean, again, we are now entering a phase where people are opening up, restrictions are lessening, so there's going to be more contact with other people. Again, I think for adults, it's not really a problem to physically distance. Kids, I think, definitely have a tougher time doing that. They are going to be in more contact with each other, especially if you're thinking about youth sports on the benches or together in practices. They're going to have a lot more contact. At that point, you are allowing other people who are not in your typical bubble or who are not in your household to be coming into contact with each other. There is that risk there. We know the virus is out there. We know it is certainly quite prevalent around the United States and around Kansas City. We see new cases every day. So I think you are making a risk, you are taking a risk, and that is something you have to judge for yourself. But the risk is definitely there, and it is only probably going to increase as our restrictions lessen.
Is there any part of that that may be dependent upon the age of your child, if you're heading back into youth sports especially? Like if you've got a teenager, maybe they're a little bit more able to maintain social distancing and know what the guidelines of what they're supposed to be doing than if you have a young child that maybe can't pay attention to that. Should that be factored in at all for parents that are trying to decide whether to let their kids go back into it?
Again, some teenagers are probably better at it than others. I think it's really difficult. You can certainly try to mitigate risk, again, such as being on the bench. Obviously, if you're standing out in the outfield, it's not so much a problem. You're not having contact with other people, but you're still using other equipment that other people are using. You could be taking water from other water bottles that other people have been using, so there is huge risk there. So I think just the physical distance is not the only thing, but it's other use of equipment and things of that nature as well.
Yeah.
That's a good point. Doctor, as daycare start to open back up, parents have to head back to work. Some parents have been having to send their kids to daycare continuously through this if they're essential workers. If you have to send your kids to daycare right now, what are some precautions that you should be thinking about with your kids?
Well, obviously, we know, again, like you said, that the daycares have been open, so people have been using them. I think it's important to understand exactly how many kids are there. That is difficult because even one or two children can spread the disease with having mild or no symptoms at all, and then spread it to your child, who then brings it home to your family. That's really difficult. Again, I think probably the amount of children there and the amount of other households. I think it's on the the person that's running the daycare to understand and maybe put some mitigation practices in place, like be screening for people who are ill, as far as asking questions. Is there anybody ill in your household? Is there anybody who's been diagnosed with COVID-19? Certainly maybe hand hygiene. Make sure that the kids are doing alcohol or hand washing when they come in, when they leave. Little things that could possibly mitigate any risk at all.
Dr. Hawkinson, one term that you have used with us in these interviews before is the virology of this particular illness, and we're still learning about that. This is still a learning process and a learning curve with COVID-19. I want to ask you about symptoms, because we're learning that there are some new symptoms showing up that aren't necessarily what we've said from the beginning, the shortness of breath, the coughing, that kind of thing on the CDC website. Can you talk about some of those new cases and new symptoms that are being experimented with and seeing right now?
Yeah, anything in particular? I mean, we know about the lack of smell, lack of taste. Some patients will have, mild diarrhea, so GI symptoms rather than the respiratory symptoms. We understand that certain types of rashes may occur as well. Is there anything in particular?
I mean, all those are different because I think we are all still learning about, I think a lot of people keep making that comparison to the flu, and we expect to have flu-like symptoms, and those aren't not necessarily the case all the time.
Yep. I mean, again, the majority of the people probably will have fever, 60 to 80%. Majority will have cough, 60 to 80%, and then shortness of breath. But yeah, certainly these atypical symptoms. And, you know, it may have to do with exactly where the virus is able to get entry into cells, because we know the receptor for the virus is on all these places. It's in your kidney, it's in your GI tract. It's possibly on the nerves for your smell, so that's why you have lack of smell. But then we also understand that there are inflammatory reactions and other processes going on that are related to the virus, but not directly to the viral infection. And that's what we're seeing a lot maybe down the road, such as some of the respiratory failure. Some of these childhood presentations, such as the Kawasaki-like syndrome, which is more of a vasculitis or having to deal with the blood vessels. So this virus just causes havoc both by itself, entering the cells and destroying the cells, but also the immune reaction that our body is having to the virus itself.
Yeah, we've heard lots of different cases of people having almost no symptoms at all or very mild symptoms, to people who have fever for 2 weeks and lose taste and smell for a week at a time. So lots of things that we're learning about this. Dr. Hawkinson, thank you so much for this morning. We'll check back in with you this morning at 6:45 with some more questions. Thank you.